nga malemtay amin kakabsat, karuba, interamente ti Ilocandia. Nadanon iti oras ti programa tayo, nga trabaho ken serbisyo, dahito iti bulan iti Abril, ket nasoroken kumurang nga 30 nga episodes, 30 nga episodes ti daytoy programa tayo, nga trabaho ken serbisyo. Ket gaputa iti Ilocos Sur, adda iti nayulog nga executive order, nga nagapo iti gobernador tayo. So, the Executive Order number 28, Series 21, we are under MECQ. Dahil kunata yung Modified Enhanced Community Quarantine. Nasurok nga makataw-ene na po. Nasurok ti sumagmamanungal daw nga na-experience tayo dahil nga deklarasyon iti Enhanced Community Quarantine saan laing nga ti probinsya tayo, ti Region 1, kinenteramente nga Pilipinas. Nag 1-year anniversary tayon. Ngayon kit di imbes nga bumabaw wenno mapukaw, dagiti cases iti naapektaran iti COVID-19, at damet surge nan wenno pimmangato iti kaso tayo dito yung probinsya tayo nga Ilocos Sur. Iso nga napanunot iti gobernador tayo ni Apo Governor Ryan Singson nga we shall be under kunanay di. Ngayon manipod April 7 naging gana April 21, we are under MECQ. Haan nga interamente nga probinsya ket under MECQ. Adda duwa nga syudad dito Vigan ken iti Candon ken sangapulo ket maysa nga munisipyo ti both districts, first district and second district nga under the MECQ. Ket itatang malem kakabsat sa nga ili tayo, when resource person tayo, guest tayo, special guest, daytay incident commander iti IATF ti probinsya tayo nga Ilocos Sur, isuna pa iti chief iti hospital, iti Ilocos Sur Provincial Hospital, Gabriela Silang General Hospital dito'y Vigan, ni Doktora Trina Taboga Talaga. Ngayon, very busy isuna, iso nga umayon dito'y studio tayo, tanagapupay laing di jay sinait, di magasti na dumadumang nga hospital, nagiti district hospital, ken nagiti dadumapay to monitor the activities of all our frontliners, especially nagito'y health workers tayo. Ket a few minutes ago, na-monitor tayo nga asidegen ni Dr. Trina. Isonto po iti pagdamagan tayo, nagiti na dumaduma nga concerns, when no anya nagiti guidelines, when no protocol, iti panagbalin nga MECQ, no, apay nga under MECQ, dagito'y duwa nga syudad, ken sangapulo ket maysa nga ili ti probinsya tayo nga Ilocos Sur. Ket kumusta kayo, apo, nga buybuya, kang runaan na karigiti adda iti balbalay na, wenno dapay laing iti trabaho. Sapay kumata, kang kanayon nga alert tayo amin to be safe, to be protected, by following all the protocols and the health standards. Ngayon paulog, iti IATF tayo dito yung probinsya tayo, ngayon daulwan, ti ingunguten tayo nga nakagagaget, very dynamic Governor Luis Ryan Singson. Dagi title po dagi in paulog ng executive order, iso dagi an order placing the cities of Candon and Vigan and the municipalities na to yan, nagito nga ilili, Cabugao, Bantay, Sinait, Cervantes, Narvacan, Santa Maria, San Esteban, Santa Lucia, Suyo, Tagudin, all in the province of Ilocos Sur under modified, enhanced community quarantine and providing guidelines thereof. Iso nga, kaadwan na dagito nga ni-mention nga ili adada iti datay ayan ti border when boundary kadagiti sa balipay nga ili probinsya, kung nakit di, iti Region 1, kas kumadjay sinait. Isureta ti border tayo, iti Ilocos Norte. Itagudin, isumet iti border tayo, iti La Union. Dito'y Narvacan, border tayo iti Abra. Ket dito'y met Cervantes, border tayo di jay Benguet. Iso nga, adda gito'y Sombrecan, ken Rumwaran, dagiti umay dito'y probinsya tayo. Ket amwen tayo ken ni Doktora Trina, nun niya dagiti specific, wenno detalya, iti restrictions nga sumrek dagitoy nga taga-sabali nga probinsya, ditoy probinsya tayo nga Ilocos Sur. Kablaawan tayo apo, dagiti adda iti live streaming tayo ni Gina Joven Flandes is watching. Hello Gina, kang kanayon ko makikita tinagan mo no ditoy live streaming Jake Pleldad. Be safe ko na. Siguro dahil field ni Jake. Nya? Iso nga kasi bumblebee na to'y internet nga signal. Okay? Ni Tommy Bermudez Athas. Anag tayo kailian. Ket ko na namet ni Lijay dyan. Tumay tayab met. Nya? Dada siguro amin dagito iti field din. Yung pumasilig damet ten. Tumay damet ito yung tumulong dito yung studio tayo kakabsat. Nasaya at matlatamam ko na ni Tommy. Lockdown dito'y ayan mita. Abigail Pimienta, good afternoon ma'am. Kablaawan kayo amin na po nga adda nga duty nga barangay health workers, barangay council members or officials taadura gitay na lasatak nga addada iti sirok iti tawag mo diyan apo addada gitay abong-abong na wenno sirok iti mangmangga nga barangay health workers agiti nagagaget nga BHWs, volunteers, tanganod, kastamet agiti barangay councils. Ada duty da manen apo ket saluduan tay amin nida ta naka-duty da manen at ada manen iti BERT daw na barangay emergency response team ti corresponding or appropriate nga luglugar da. Ket ituloy tayo kakabsat nga basain when ipakamu kada kayo daytay naipaulog nga executive order ni Governor Luis Ryan Singson. Kastamet nga damet executive order iti local chief executive iti capital city of Vigan ni Mayor Carlo Medina. Ket si Mang Pete na po, dagitay bisita tayo. Ket makita nga very busy da ngamin, makita ka kasla uray pa nabanugdan adadala ta ditoy nga makidanggay kada tayo iti team ni Dr. Trina Taboga talaga. And we are very happy to have her team here to explain fully the protocols and all the concerns. Tapno, nasaysayaat, tintay panagbiyahe, nasaysayaat nga intay sangwen, dagiti karit nga kang kanayon, iti COVID-19 pandemic. Okay. Si Mang Pete na po ni Dr. Trina, in a few seconds, she will be joining me here. And we will ask her so many things and she will be discussing with you tay kuna kung nagitay protocols kano apay nga addatay manen when they declare manen ni Apo Gobernador tayo ni Apo Luis Ryan Singson that we are under the modified enhanced community quarantine. Mabalin pa ito pa nga saludsudan no nya diferensya ti MECQ ken ECQ. Anya dagiti paganurutan iti provincial government tapno datay amin sang sangkamaysa to fight against the pandemic and to decrease the prevalence rate of this virus. There you are. We would like to welcome datay nagaget nga incident commander tayo ti Interagency Task Force against COVID-19 iti probinsya tayo nga Ilocos Sur. isuna po iti chief, iti hospital, iti Ilocos Provincial Hospital, Gabriela Silang General Hospital, kaya't manarimaan pa kaya't di karatingal daw nga nagra-rounds, ken binisbisita na aming district hospitals in the province, kagapgapo na jay sinain. Kablaawan tayo po, taludang at datat ta itoy. We would like to welcome you, Dr. Trina, to our show, Kabsat Detiket Trabaho ken Serbisyo. Originally, this is a platform to disseminate the programs, the projects and activities dagiti aming national government agencies. And this is live ever since. Hantay pa'y nga nagliway ti kada Tuesday since the last week of September. So nga manong nga bulan tayo na po. Kablawan tayo ni Dr. Trina, naimbag nga malem mo, Doktora.
Naimbag nga malem mo, tita. Naimbag nga malem mo yung amin na po nga buy-buy ang kanya tayo tata.
Oh, nagsik nga. Denggen di pa nagsauna ti Lucano because when I watch the press conference hagtag Tagalog isuna. So nga, among di makil di Manila na tinguping, no? But she's just around the corner. You know, Taboga family is close to us. I would like to greet your family as well. Okay. Okay, so how are you?
Okay lang naman po. It's a bit toxic now compared before, pero we're managing it.
Oh, that's great. Tell us, apay nga in-declare, when apay nga the executive order ni Governor Ryan, iti duwa nga cities of Ilocos Sur and 11 municipalities.
Yes, because if you are monitoring our COVID update, talaga naman pong there is more than 400% growth rate in the number of cases.
Okay.
These past 2 weeks, we've had around 300 plus, almost 400 cases.
Just for the past 2 weeks,
Yes,
the Semana Santa.
Yes.
Okay.
Actually, 400 already.
Wow.
Yeah, which is way more than what we had since March 2020.
So compare the record of 2020 and 2021, ad-adoa po iti kaso tayo dito probinsya tayo nga Ilocos Sur. Are there casualties also, Doktora?
If you mean mortality?
Yes, mortality.
Yes, death. Yeah, we have had a total of 10. For the past 2 weeks, 6.
6 laeng. Iso nga masapul nga amwen tay amin kakabsat no anya dagiti protocol ken health standards iti Department of Health kasama iti Provincial Health Office tayo. Iso nga Doktora, give us an update ta no 400% tingin matuan na anya nga ages wenno anya nga sektor dagitoy na apektaran.
Very broad ang range nila.
Yes.
We have kids as young as 1, and then we have senior citizens as young as 90.
90 years
as old
old.
as 90, yes, tita. Talagang very wide po yung
Yes.
scope
And,
ng
and I have
age
learned
range.
that even health practitioners and a district hospital was closed. Is it true na closean iti Santa Lucia district because adu dagiti na-transmitan wenno na apektaran nag-positive nga health professionals? Is it true?
Tita, it is true that District Hospital Santa Lucia is now shut down for regular operations, but the reason is not because of the infection, not because the health workers have been infected, but because we need to accommodate more patients.
Okay.
Yes, so because we are already running short of COVID teams and beds wherein we can accommodate the symptomatic ones, especially the ones with comorbidities.
Yes.
So we had to shut down Santa Lucia.
Okay.
We did that strategically because may hospital naman ng Candon, may hospital ng Tagudin.
Narvacan.
Yes, so the regular patients can go to these hospitals instead while Santa Lucia caters exclusively for COVID with comorbidities.
Okay. We have also learned nga dito'y first district at the facility tayon. There is a newly established or erected nga kasaltay COVID facility tayo. Is it true? Is it in Magsingal? Tell us more about that.
Magsingal, District Hospital Magsingal, actually the new building is for originally intended to upgrade the hospital. So it was supposed to cater to regular patients. However,
Yes.
because of COVID,
Yeah.
if you remember, we shut down the hospital also for a few months.
Yes.
So when the building was already ready to admit patients, we used the building for COVID instead.
Okay. So, dalita nga facility tayo. There was also another established facility, di Jay Narvacan, the di in-launch niya po gobernador, and I saw you there as well.
Yeah, yun po ay isolation units talaga, which later on we had to add more isolation vans to accommodate more patients. That was in anticipation of the surge.
Okay. Doktora, ano ti-highlight the executive order ni Governor? Sino dagitoy mabalin nga sombrek? Tira gitoy boundaries tayo, meaning coming over to the province?
Yeah, so we place these 13 LGUs under
Yeah.
MECQ because there is already an existing local transmission inside the province, and the LGUs with identified number or sustained local transmissions and beginning local transmissions are those listed under the 13 LGUs.
Okay.
Kaya po the one of the strategies that we thought could help mitigate the transmission is to limit the movement. So kaya po binaban
To and from
those 13
those 13
LGUs. Yes.
LGUs. Okay.
Yes. So who are allowed to enter the province?
Well.
Lahat pa rin po ng APORs, those, for example, Ilocos Sur resident working in neighboring provinces,
And who come back home?
who should come back home because they have no other place to stay there in the neighboring provinces, or residents of our neighboring provinces working in Ilocos Sur. Sila po are free to come in and out. Basta po pag nandito sila, they have to limit their movement, and then they have to subject to surveillance monitoring, regular testing, ganun po. And then the cargos, of course, couriers, they have always been unhampered from the beginning, even when there was ECQ, which is a more escalated community quarantine status. And then emergency travelers, frontliners, and those who are traveling for medical needs that are not available in areas under MECQ.
Okay. So, the boundaries tayo na-declare under the MECQ, like Narvacan, Tagudin, Sinait, as well as Cervantes.
Yes.
So, kasano ti sitwasyon karagito nga boundaries tata? Sino dagiti adda ditoy working in our boundaries? It is also a multi-agency. Kasi interagency task force, and you are our incident commander. So they receive instructions from the government through you, from the governor through you.
Yes.
So how is the coordination, Doktora?
I constantly communicate with them.
Well.
We have a chat room via Viber wherein all issues are brought up there, and then I meet them regularly, siguro at twice a month basis kung kaya, sometimes as needed kung biglang meron tayong bagong executive order, especially those concerning the borders. Yun po. So, I meet them regularly and I constantly communicate with them.
So, DJ interagency task force ket adda iti Philippine National Police,
Yes.
Department of Health. Sino dagitoy agencies nga involved, nga naka-station kada gitoy nga checkpoints and boundary areas tayo?
Right now in the borders, we have the PNP and then the BFP.
Bureau of
Tinutulungan
Fire.
sila ng BFP.
Yes.
And then siguro if we're gonna set up the testing at the borders again, there will be nurses too.
Nurses.
Coming from the district hospitals. Yes.
Okay. Dagijay sombrek, Doktora, anya dagitoy paganurutan. Kada gitoy apors, kada gitoy subli ditoy, agbisita. Do we have, siyempre, awanti turismo, nawan ulit isang sombreken. But anya dagitoy requirements, dagitoy aside from, you have the S-Pass, you have the official quarantine pass, as well as the worker pass. Tell us more about all these passes, Doktora.
What is very important to us is the coordination.
Okay.
So, for example, you are an APOR, you're a worker working
Yes.
somewhere else, or
Yes.
you are from somewhere else working here. We usually practice the border work pass.
Border.
Yes,
Yes.
yung border work pass is issued in either LGU of residence or LGU where your work is situated. Whichever applies, pero syempre within Ilocos Sur, galing sa Ilocos Sur yung mag-i-issue ng border work pass. And then that gets validated every time they go out, they come in through the border and the RHU of the respective LGU.
Okay.
Yun pa. And then, pero nung nilabas yung Resolution 101, yan po ay nagkaroon na tayo ng SPAS, mandatory use of SPAS. Ang na-encounter natin dyan, of course, nung una, because it's a new system, merong lagging, nahihirapan talaga silang mag-log in. Nahihirapan din kaming habulin yung number of applicants.
Okay.
Which we were able to correct naman in 1 to 2 weeks period.
Okay.
But after we did, yung mga tao naman, they only apply for SPAS once they're already in the border.
Well.
Kaya nadidelay po sila. So, if they're watching, I hope na...
They become patient enough.
No, I hope that I can be able to communicate to them that if you are traveling and you plan to cross the borders coming into Ilocos Sur, please apply for SPAS at least 1-2 days before travel.
Your travel.
Yes.
Okay, so nangigan tayo dahil kakabsat niya. Tadi tayo ito madelay di jay border. So prior to your travel dito probinsya ti Ilocos Sur, ag-apply kayo ti dito SPAS. At dapat rin the live streaming tayo dito doktora. Good PM po, stay safe tayong lahat. Good evening. Musta po sa lahat? Kinukumusta kayo? Kasi nasabi ko earlier that you are coming from the field. Ket pagyamanan mi unay dito sa channel. Dimiretso ka dito, doktora. And then, mababakunahan po ba lahat? Good afternoon, ma'am. Before we go to the vaccination program of the provincial government, let us focus pa lang kareto'y pandemic, nunya dagiti kondisyon. So, naisarita ni doktora. Anya pa'y dagiti paganurutan ti general public na surutan lang.
Of course, hindi po mawawala yung minimum public health standard. Yun po minimum public health standard is to use mouth coverage, mouth and nose coverage. Ito po mga face mask na ginagamit natin. Hindi naman po kailangan KN95 and 95 or medical grade kung nasa general public area lang tayo. Kung nasa hospital, that's when we really require yung mga KN95. Pag nasa healthcare facilities.
Okay.
Other than that, when you go out, you should always wear your face shield.
Face shield.
Yes, kasi ayaw nating matamaan ng droplet yung mucosa ng eyes, yung mga yan. Protection din po yun.
Yes.
And then always practice social distancing. At least 1 meter apart. Kasi hindi pa naman airborne yung virus, more on talagang droplet transmission siya. So if you maintain enough space between you and your whoever you're talking to, or whoever you are with, then it's less likely that you get the infection. Ngayon, especially now that we have almost 400 active cases, we appeal to everyone to please limit your movement to essentials only. Kung pwede, kung kailangan bumili ng pagkain, ng gamot, magpa-check up, hanggang ganun lang at trabaho. Hanggat kaya, saka na tayo mag-reunion with friends. And,
Get together, no?
Yes.
Essential, it means going to the public market or stores and groceries or supermarkets to buy daily needs of the household. And to buy medicines, to buy water, that mineral water tayo kakabsat. Can emergency cases, dagsakit ti pamilya, nga may pan iti clinic or iti hospital. Has there been any case nga dati naglabsing kadati may nga general rule which is iti rabii aging gana tayo lang alas 10, dati curfew nga ko natay doktora. So it's still 10 o'clock and then 5 o'clock in the morning?
We actually extended that to 12 midnight already.
Okay.
But then when our cases increased, we declared the MECQ, binalik po natin siya sa 10 p.m.
10 p.m.
Yes.
But generally, prior to April 7, up to 12 o'clock, mabalin pa lang
12 midnight to 5 a.m. Yes.
Okay. Digi age bracket, sino ti mabalin nga makaawat ti dati official quarantine pass? Doktora, please explain.
Under MECQ po, 18 to 65.
65. Ado makita dita, dapat kabalay ko, who goes out to buy medicine, go to the bank, but he is just an alternate pass holder.
Yes.
Is it true nga may salaing nga member of the household ti may kan iti official quarantine pass?
Supposedly, yes, because if there's an APOR in the house or
Yes.
there's a worker in the house, supposedly nga sila na lang yung gagawa niyan, bibili.
Yes.
Yeah.
On behalf of all the other members of the household.
Yes.
Okay. What about traveling by motorcycle? Anya giti restrictions when nya ti mabalin nga may allow nga back ride?
Yes. Normally, hindi sana siya pwede, yung back riding.
Hindi
And
pwede.
Yes. Kaya lang since yan nga yung main mode of transportation, Gov. Ryan said we should modify the EO in such a way that we do not paralyze naman the people.
Yes.
So, he is allowing tricycle, of course, and motorcycle, and pillion riding.
Okay.
So long as you belong to the same household.
Okay. So there's no need to present any document that you are the husband or the wife of so-and-so and the child and the daughter of so-and-so.
Yeah, tita, before kasi very funny, they used to post pictures na they were holding the wedding pictures. They were holding the wedding pictures and then
Funny!
very funny. And then they were presenting the marriage certificate, something like that. There's no need to do that now because of course the barangay knows
Yes.
kung sino yung magkakabahay. So they're the ones who are only allowed to do pillion riding.
So sila ang nakaka-identify kung sino magkakasambahay.
Yes,
In fact, itong mga barangay officials tayo, even our barangay health center, sudati nagiwara sa reto, doktora,
Yes,
quarantine pass or even the worker pass. So they know who are members of one household. Kung sino ti agkakabalay. So we're very happy that the governor has already issued a memo or an executive order allowing dagitoy nga agkakabalay agasawa nga aglugan iti may nga motor or even tricycle or any vehicle for that matter. Yeah?
Yes.
Okay. Now, can we go to other areas like that we open business or open institutions or agencies for general purposes? Anya ra gitoy nga paglintegan. Sino ti mabalin nga aglukat, sino ti masaraan? When mai-recap iti establishment na, doktora.
Yes, basically lahat naman po ay allowed. Only at a reduced capacity. Of course, food services, food preparation, nasa 100% yan.
Okay.
100% operation. Drugstores, nasa 100% operation.
Okay.
Ang talaga lang hindi pwede, prohibited right now, beauty parlor, salon, spa, like that.
Naku, awan na giti rebonding na giti
Yes.
the color. Okay, massage, hindi rin pwede.
Massage, hindi
Wow.
po pwede kasi contact yan. And then, itong mga gym and spa, bawal din po muna.
Yes.
But we have, I hope we make you understand that this is just for a period of 2 weeks.
Right.
Yeah, we just really have to flatten our curve and then everything will go back to...
Actually, by tomorrow, nalpas si may isang Domingo.
Yes,
Okay,
po,
kung natin, sa tingin niyo po, sabi ni Scarlett Grace Achon, may extend kaya ang MECQ, doktora?
That is something that I cannot answer for sure right now because it's gonna depend on our statistics.
Yes.
Depende po kung gaano pa karami yung matatanggap nating positive results. Saka depende po kung gaano pa siguro kung may mamamatay pa ulit.
Wow.
Yes, and depende rin sa control nung LGU placed on MECQ at nung LGUs who were not placed on MECQ yet.
Okay. So, we have learned nga ti DILG, ket iso iti kasla kadwayo nga mang-coordinate iti trabaho dagiti municipal local government MLGOOs nga kunada or offices. Do they submit to you on a daily basis the prevalence rate, the cases in their respective municipalities?
Yes po, however, kami kasi sa health, especially sa task force, we rely on because, for example, somebody gets positive, that is now loaded in our database. We have the control of the database. Yeah, so, yan po, hindi dumadaan sa MLGO. Sa kanila, more on the persons under monitoring, those admitted in quarantine facilities, yun po yung namomonitor nila.
Okay.
Yes, pero sa task force po, we have direct access to the database.
Great. Dito capital, iti base, iti IATFT province, ang kadi, Doktora?
Yes po, but the action center has already been moved to Gabriela.
Sa inyong hospital.
Yes.
Because you're the incident commander, I think it's very logical nga di jay tikwa. Very fit nga di jay Gabriela, iti command center.
Nandun lang po kasi yung provincial health office,
Yes.
and the supplies, so we had to move it there. Plus,
Okay.
para ma-lessen din po yung tao sa capital.
Okay. And then, we also have some greetings here. Mega Sambawa. Good afternoon, ma'am. Doktora Edwin Viernes is also watching. Hello there, Apo. Scarlett Grace, kunana pa dyan. Paano po kung hindi mag-asawa ang magkasakay sa motor? Ano ang kailangang requirement? Do you mean mag-boyfriend, agkaruba, or agayem?
Yes.
They're not very strict on that. Ngayong DJ barangay kakabsat, Apo Scarlett, lagi ito barangay officials timang determine nung mabalin ang kasakay na duwa nga tao. Because what is allowed is you belong to the same household or family house. Okay. Luis Marius, essential po ba ang lugaw? Ano kayang ibig sabihin nito? Mapangga, lugaw. Inayon ko man iti bagnet, sinanglaw, Miki, Doktora. Okay.
Essential naman po yan. Pagkain po yan.
That is essential. No? Ano makatakanin kay iti sinanglaw ken empanada, come to vegan, no? Kasi masapulmet nga magnat ekonomiya tayo, agsapulmet dagiti po nga ada iti chen-chendana. Okay? Good evening, ma'am. Kuna ni Jean Claude Solis. From your BPA 3 students. Oh, hello to all my students. They've been required to observe the implementation of all these local government guidelines because I teach them local government and regional administration. So, current events, Doktora, these students at the university are very keen and they show their observance and opinions on how the IATF, the local government or the provincial government work hand in hand with the civilian or with our general public.
That is a very effective campaign, Tita.
Yes, yeah. I hope you don't mind kung ano daduma. I really require my students on good governance and accountability in the public service. And they appreciate the impact of our program here to their learning. And they even share what they learn here to the officials of their respective areas, ibar barangay da. So nga, adutig buy-buya nga estudyante ken ka, Doktora. So nga, these are young
and idealistic.
the youth.
Yeah.
The youth, adutig buy-buya to. At the same time, adutig buya po outside the province. At dapat yung taga Bulacan, o dado mga ga-ask questions, and even from outside the Philippines. We have watchers from Dubai, from London, from Hong Kong, to end the Middle East. So nga, uray no live tayo kakabsat, ma-replay detoy if you visit and you subscribe Kabsat channel. Okay? So, siguro mabalintay nga damagan kani Doktoran, no, kasano datoy vaccination program iti provincial government of Ilocos Sur, Doktoran.
Yes, so, at the first height of the vaccine, nag-craft na po ang provincial government ng provincial vaccination plan. That was even before any rollout, nung nalalaman pa lang natin na meron ng dinedevelop na vaccine. So, the provincial health office, through the COVID Action Center, and through, of course, the instruction of Gov. Ryan, already crafted the provincial vaccination plan.
Okay.
And then when the first batch of vaccines arrived, immediately, the same hour, we inoculated yung first batch. That included me nga. Yes.
So priority kayo nga the health profession, dagiti the doctor, nurses, frontliners.
Yes, and I really had to lead them. I really had to be the first one in order to increase confidence.
Right.
Yeah, and
right.
to encourage them. Kasi sabi nga po ni Gov. Ryan, this has been going on for 1 year already. Just when we thought we're already seeing the light at the end of the tunnel, sabi niya, words niya yun
Oo.
may mga bagong variants na. So,
Yes.
kailangan naman kahit papano, there is a shield, there is an ounce of protection for the health workers. Yes. So, kasama po kami sa A1
Okay.
priority group.
Ilang beses or dosages yung vaccination na ibinibigay o ini-implement na programa ng provincial government?
Right now po kasi we have two brands of vaccine. We have received 2 brands of vaccine from the national government. The first one is Sinovac, and then the second one
Sinovac.
is Astra.
Yeah.
Both of them are given to you for 2 doses.
Okay.
For Sinovac, you get the first dose now, and then after 28 days, that's when you get the second dose.
But for the other
For
brand?
the other Astra, you get the first
Astra.
dose after 3 months. That's when you get the second dose.
Okay. Is it the choice of the provincial government na gito'y nga brands of vaccines? Because there are other, like from Pfizer and Moderna, and we hear other pharmaceuticals that are selling or providing vaccines in the country.
Honestly po, right now, whatever vaccine that's offered to you with an EUA,
Okay.
emergency use approval in the Philippines, issued by the Food and Drug Administration of the Philippines.
Okay.
Tatanggapin mo na kasi ang hirap po. There's a competition in the market.
Right.
Yes, but these are the vaccines that we received were actually donated to the national government by the COVAX facility.
Okay.
Dinistribute po nila down to the LGUs. Although we also are making a purchase, which we planned for so long, we had to conduct different meetings with the different mayors, different LGUs. Right now, we are actively negotiating with 3 pharmaceutical companies. So, Novavax of India.
That's for the whole province.
That's for the rest of the adult population who are not included in the priority group.
Meaning senior citizens, professionals who are not...
Could be senior citizens, could be professionals, could be anybody between 18 and above.
And above. Okay.
Yes, na hindi po priority ng DOH because the national government promised to provide for 50 to 70% of the population.
Not the whole population
Not
will be
the-
vaccinated.
Yes.
Dagiti bubing, doktora, they are not authorized or they are not within the program?
Right now, Tita, with the available vaccines in the market,
Yes.
there is not enough study there's not enough study that suggests it is safe for the children below 18.
So, 18 and above, ti adadang ay priority, iti gobyerno tayo.
Yes po. Plus because those below 18 naman should always stay home.
Yes, ang damit mabaling nga pasya-pasya, raglalo no adda iti MECQ, iti may isang lugar o probinsya.
Yes.
Okay. So, DJ, nagkunamit tatay nga to build confidence muna kayon nga nagpa-vaccine. And how was it? How did you feel? Kasi ado dagiti madamdamag nga after effects or anyaman dagiti marikrik na dagiti nagpabakunan.
On the first day, wala
Yes.
po ako naramdaman. On the second day, I had colds.
Colds.
A little, yes, and I had episodes of headache. Yeah, and then siguro very slight fever. But that was it. Very, very mild.
It doesn't take long. Siguro a
Yes,
day or two nga damarik na yung mild headache and mild fever perhaps. Masakiti wagbagi.
Yeah.
Okay. Kaya ni nga mamuna po nga noan niya from health providers or practitioners sino ti isaruno yon nga pabakunaan
Definitely.
based on the plan of the provincial government.
we follow po the national prioritization plan. So, after all the health workers, ito pong senior citizens.
Yeah.
Yes, and then the indigents.
Kung senior citizens, uray no anyang kondisyon, meaning awan ti saksakit da, kaadwan na ngamin ti senior citizens, sakit ti puso, nangato iti blood pressure, or
Let me correct that,
diabetic.
Tita.
How is it?
Senior citizens and those with comorbidities.
Yeah, i-explain mo, doktora.
Hindi
Okay.
po, lahat ng senior citizen, whether may sakit or wala, plus yung mga hindi pa senior citizen na merong mga sakit na magpa-predispose sila to being infected.
All the more that they should be vaccinated.
Yes,
Kasi mapreventaran iti panakay-transmit daytay nga virus.
Yes.
Ado nga mintay mabuteng doktora, dot madamdamag ko no makipatpatangak ti tao.
Buhay pa naman kami.
Ado
Okay,
dagiti stigma ngano da sakit mun haanen, no? When agur-uray da, tadok madamdamag da nga epekto na raytoy nga vaccination.
No, actually, ang contraindication lang naman dyan is kung meron kang allergy sa particular,
Yes. Unon ma-inject ka, at daragiti allergies mo. Now, did they ni-vaccine kan ka after 28 days? Okay? So, talaga nga, the record, iti RHU, di implement no DJ local government? LGUs?
Yes. And when you get vaccinated, there's an online registration that is immediately transmitted to the national.
Okay.
So, yes, meron siyang centralized database.
So there is no need to register for the vaccination. Automatic na ti LGU ma-identify the health practitioners and then the senior citizens and then sino ti sumaron, the mature, aged individuals in the community.
Yes, supposedly because even before the rollout, there had been series of trainings and seminars via Zoom.
Among the RHU personnel, local health
vaccinators, health stakeholders, like that. So, alam na po namin kung sino yung uunahin at hindi. And then, with the provincial vaccination plan, the LGUs already made their initial census.
Okay.
Kung ilan po yung those under the priority group, those who are not qualified under the priority group. Basta yung total adult population nila, alam na po
Okay.
nila yun.
So far, adamanon nga nabakunaan rin, doktora. So, in the province of Ilocos Sur,
Yes, so in the province of Ilocos Sur, because we have already...
manuribon tina-vaccine, na ikanti vaccination.
Sa health workers kasi, all the hospital workers, all 85,
Government.
yes. No, even private.
Even private
both private
hospitals.
and government hospitals and clinics
Yes.
within the province. 85 to 90% have already received the vaccine.
So almost.
Yes, and then in all the LGUs, we have already distributed thousands of doses. However, hindi pa na 100% lahat ng health workers nila.
Okay. So, donated po yung vaccine. So, the provincial government is not spending for that. Siguro operational expenses, but not necessarily yung vaccine.
Ito pong first batch.
Okay.
Yeah, but the provincial government is spending a whole lot more for the rest of the population, which we expect to arrive, hopefully, after May.
Okay, after May of this year. Dapat question dito, greeting from also from Namnama Scholar to Distrito Organization headed by Chairman Lennox Pilarca Quinola, ma'am. So these are young leaders of the province. Nay napukawakon. They roll out, doktora, ng rugi karay nga tawen. And you intend to do this, the target yung plan at the end of the year or what particular quarter of this year?
That is something that I cannot be definite on because it depends on when the supply is going to arrive.
Okay.
Like I said, we are actively negotiating with 3 companies, 2 companies from India and 1 from Russia, yung Sputnik.
But not from China.
No, no, Tita, because we have a big number of senior citizens, and these vaccines from China are not recommended for senior citizens. So when we planned on purchasing, we had to consider that it should be safe for all ages.
Okay, wow. Nagadugayam tinaramidan ti provincial government and kakabsat. At that toy, Luis Marius, pwede po bang ma-explain kung ano pa ang kailangang ingatan maliban sa mga protocols na pinapatupad para makaiwas sa COVID, Doktora? It's a question from Luis Marius.
Siguro lang we have to be always conscious. We have to be very mindful of our actions, the places we go, the people we talk to. Yan po. Because sometimes, even if we do wear mask, unconsciously natatanggal natin, lalo na if it's getting uncomfortable, especially itong mga face shields na to, and it's already summer, napakainit, unconsciously natatanggal mo siya, and then sometimes pag nag-grocery ka, or may nakasalamuha ka, or for example, nagpunta kang office, may nahawakan kang doorknob, akala mo wala lang, pero what if may COVID yung sinundan mo? So, always wash your hands, or always carry alcohol with you para meron kang pang sanitize. Yun po. And then kapag ka at the first sense na meron kang nararamdaman kahit konting sipon, naiisipin mo ay allergy lang kasi nagkaka-allergy ka in the past. Maigi siguro na dumistansya na tayo kung may baby ka man, kung may magulang ka. Mag-self-isolate ka lang, konting distansya, yung ganun po.
For the pregnant women, narigat pa iti kanayon nga rumwar, dapat kita dakay ti uneg ti pagtaingan niyo kakabsat, no?
Yes po, talaga. As much as possible, please stay home.
Stay
kung
home.
Hindi naman kailangan. No, adamit sa bali nga agsapul para kanyayo. But, like I said, hindi po pinagbabawalan. Alam natin, we understand that we all need to earn a living.
Yes.
Yeah,
At dapat may isang practice nga na isuro iti may isang doktora kanya. DJ, nung naggapu ka tirwar, you wash your hands but take a bath as well.
Yeah.
Can DJ agsukat kay tibado mo, kawil mo dyan laundry basket because di tayo mo lang nga ima, wano rupa ti apektado, pati pa'y baka ada na kawarsi ti something dito'y lupot tayo. So nga, tayo nga dublen dagi jay nga nausar tayo, no rimwar tayo kakabsat. Masapol nga ikabil tayo DJ laundry bin tayo. At na may isa nga saludsud pa ito'y doktora, ano ang mga pagkain na panlaban sa COVID? Siguro di intake tayo, nyamit ti may share mo, kada ito'y agdingdingeg, ano buybuyag, lalo kini Luis Marius nga nagdaman.
Hindi ito directed against COVID. Siguro I will have to base it on yung general na nutrition. Kailangan balanced diet, of course, para mas maganda ang ating immune system. Kasi, of course, there are kinds of diet na predisposed to hypertension, to diabetes. Yun yung maiiwasan natin to make sure na healthy pa rin yung katawan natin.
Right. Dapat source of vitamin C. Ado ti mangga tayo dito probinsya. Yes. No? Minum tayo ti kanayon nga, ihan lang 8 glasses yan. Ado tayo pa iti minum iti danom. Yeah?
Yes. Vitamin C rich and water. A lot of fluid. Yes.
Okay. So, lalo ta summer, doktora, ado iti kaduan na nga rumwar. Okay? Sikat nagrigat tayo nga avoidan datoy. Kadu ti mapan iti bye-bye, adu ti mapan iti swimming pools, although siguro na-close na gito yan. You also have concerns for mental health. So, what are the activities that you can inform, nga mabaling aramidan, when to keep ourselves mentally healthy? Taamok nga data at mental health is one of the concerns of the Department of Health and of course our local government units.
Yes. Total wala naman na po tayo sa ECQ and we are allowing naman outdoor activities. You just make sure you may go out, you can go to the beach, you can go to the pool. Chlorinated naman po yun.
Yes.
Pero kailangan lang talaga malimit yung number of people in those places. Regardless of them being open places, malimit lang yung number of people. Kagaya ng paulit-ulit nating sinasabi, just make sure you practice social distancing.
Yes.
Because, yes, you have to nurture your mental health too.
Right.
And when you are home, there are different platforms wherein you can talk to your friends. Ang cellphone po ngayon is very cheap already. It's
duwa-duwa
Everybody
pa
has
yung
a cellphone,
cellphone.
yes. Internet also, affordable na rin, hindi po kagaya ng dati. Zoom kamustahan with your friends, yan. And then exercise, you can do Zumba at home, you can do, dancing or whatever.
Right.
But when you are staying home talaga, I suggest you spend your time with your families. Kasi
This is the best time to bond with the other members of your families.
that is something I cannot enjoy. I have to work all the time and I miss my kids.
Yeah, but we salute you. You are a heroine, a silent worker, and yet you are out there. Amoy ko sa timartaray laing, kaya yung tatalaing ng buya, timartaray po ni Apo Dr. Trina to be with us here at Kabsa Channel Studio. She just came from the field, nag-monitor, to find out no kasano iti sitwasyon kaya the hospitals and clinics as well as iti barangay emergency response teams or BERT along the national highway from Sinait onward to the capital city of Vigan.
I actually went as far as Badok border.
Okay.
I met with our counterparts in Ilocos Norte. Yes, we have to strengthen border relationships.
Exactly. And how is it in Ilocos in the north? Ilocos Norte.
They're okay. They're also as stressed as we are. Pero kahit pa paano, hi, hello, ganun
But it
lang.
doesn't show that you are stressed. Kita niya, ti Doktora, how she keeps herself fit as well as mentally healthy so they can also attend to our concerns. Kada ito'y under MECQ ti Duma nga Ilili ti probinsya tayo nga Ilocos Sur. Let me ask you, while we are here at Trabaho and Serbisyo, how do you find your work, your service, not only through government, but to the general public? How long have you been working for our people here in Ilocos Sur? I know the challenges, you have sacrifices as well, you have a family of your own, but how do you face all these challenges, Doktora?
Ang hirap sagutin. Well, I have been in government service for 13 years, 2007. When I passed the board exam, I applied at Gabriela as a surgeon.
Okay.
Yeah, so I practiced for like 4 or 5 years and then I was designated as officer in charge in 2013. Siguro when I was given a big responsibility, that's when I realized that yes, I wanted to do this. My heart is for the public.
Oh, that's great. The biggest challenge perhaps that ipanagbalin mo nga not just the chief of the hospital of Gabriela Silang kasi provincial-wide iti-cater iti Gabriela Silang General Hospital. Dito'y siguro experience tayo ti COVID-19.
Yes, it is very difficult kasi hindi mo field lahat eh. Hindi ka lang mag-opera, hindi ka lang magre-reseta. You have to strategize, you have to plan, and you have to face all those criticisms and all those comments that because people do not understand your strategy sometimes. Because it is different if you're looking from the perspective of somebody who is protecting a bigger group of people than from somebody who is only perhaps thinking of his or her personal convenience.
Do you mean you also received bashing? Bashers nga kunada. That's a term these days. But generally for all, dakkel iti respeto tayo kadagiti health professionals, aglalo dagiti specialized nga physicians. So nga DJ courtesy kanyayo nga do doktor. You are the authority insofar as medical concerns.
Ako po personally wala. Wala. Pero of course for example, pag naglabas ka ng EO through
explain.
Yes. Yun po, yung strategies ng province, strategies ng task force, and even yung management ng teams mo, yung COVID teams mo, and kung alam lang po nila kung gaano kahirap magbalanse.
Right. So, I was watching the press conference, and dapat nagiti tilang isa sa uda is to authorize the purchase of liquor or not to authorize. Very petty matters ti kuna tayo. Ngayon for those who really drink, takiloban nagdaytoya po. Yeah? Nabuya na yung press conference yo with the governor and with our provincial director of the PNP. How is it with safety issues? While the protocols kasanumet dagitoy protection nga maited when naibaba iti Philippine National Police since multi-agency dito IATF.
Yun sila po, yung protection nila in terms of COVID?
No, protection of our general public kasi curfew hour is 1.
Yes. Honestly, the PNP is also having a hard time balancing things and manpower right now.
Okay.
Because, of course, malaking portion ng manpower nila na deploy sa borders, and then now that there's MECQ, there are other different borders too. And then, because of the surge in the province, we are really intensifying the monitoring sa compliance ng minimum public health standard. At the same time, we really want to penalize those violators to make sure that everybody complies. Yeah, to teach them a lesson and make sure that everybody complies because that is for their own safety, not just for us. So, ang nagmo-monitor din nito ay PNP. At the same time, tama po, may mga crimes pa rin na, although very minimal in Ilocos Sur, very lucky tayo. Meron pa rin crimes, meron pa rin other legal matters na kailangan nilang bantayan. So, nahihirapan din po sila. On our part, what we do is to make sure that they get tested when they're at the borders, when they are doing the frontline services that they're supposed to offer. We provide them with vitamins, face mask, face shields. Yan lang po. Ngayon po talaga, alam natin na kailangan nating lahat magtulungan regardless of kung PNP ka, doktor ka, nurse ka.
That's why I ask you that question kasi you work with all the government agencies, PNP is one, DFP, LGUs, and it is not a joke to be a incident commander. Nga po. 2 weeks lang, but it is a tedious job. It is a tedious work on your part and we really salute you. Doktora, I am being given the instructions. Nagdara si Timay sa oras. So we would like to get your last message kan pangmalagip kadagiti apo ngagbuybuya kang runaan na dagitay may panggap iti restrictions, may panggap dagiti travel authorizations or travel requirements nga umay dito probinsya tayo nga Ilocos Sur.
Yes po. So, I believe this is not the first time you're gonna hear from me. Madalas po sa radyo or sa testo nasasabi ko to. Please po, if you want to enjoy your life, you want to enjoy your family, and you want to live a happy life later, ipagpaliban po muna natin yung ating mga unnecessary movements, unnecessary lakad, unnecessary travel. Let's now confine our movements to those that are really essential, those that we really need. Please enjoy your lives. Please enjoy your quarantine or your stay-at-home process right now habang may MECQ. And when you go out, you make sure you are protected by always wearing face mask, face shield, and strictly practice social distancing. Maganda po that you have alcohol in your pockets and handy para anytime na may be very conscious sa lahat po ng hinahawakan ninyo, lahat ng taong kinakausap ninyo. Especially now po, our mortalities are increasing, our cases are peaking, and kung nakita nyo po yung announcement ni Gov. Ryan kagabi, ay kanina, meron na po tayong UK variant. And this UK variant is really scary because it is 50% more nakakahawa than the original COVID virus. Huwag po kayong maniwala pag sinasabing yung COVID ay ubosipon lang na hindi. Because hindi natin po alam kung sino yung tatamaan. Pwede pong tayo ay hindi kasi tayo ay bata pa. Paano naman po yung magulang natin or paano naman po yung mga anak natin? So, Tita, thank you so much for the opportunity to you've given me to talk here, and pasensya na napaghintay ko kayo. I had to go to the border and check the other isolation facilities. Maraming salamat po. please po magtulungan tayong lahat kasi kung ano man po itong ginagawa natin para po ito sa inyo.
Thank you very much, Dr. Trina. We do appreciate your coming over to the studio, Mamanuti Kaskenka, nga nagdapo iti trabaho dita border tayo, kaya nagdagdagas kari dumaduma nga hospitals, clinics, and to see and to monitor the activities of our frontliners. I hope that we will have you again in our program no awan tong ti COVID, so that you can you can also share your programs at the Gabriela Silang General Hospital because hanmadlay nga pandemic po ti inda asikaswen adupay dagiti health cases nga at atenderan dagiti apo nga doktor, nurses ken amin nga agtrabaho iti Gabriela Silang General Hospital. And that ends our program, our episode today. Naimbag nga rabiyo apo. Agyaman kami manen kada kayo nga nag-shout out, nag-comment ken, nagsaludsod. Tira ito live streaming tayo. And sapay kumapo, adda kay tumanen, ti sumarsaruno, nga episode, iti trabaho ken serbisyo. Awan iti dakkel nga may tedmi, nga regalo, wenno, kasi tay subalit, tira iti kaadda, iti guest tayo, special guest, Dr. Trina Taboga talaga, ngem ket di, kada kayo, kenda kami amin dito, ilalulwan tayo pati safety met, dagiti frontliners tayo, dagiti do doktor ken nurses and scholars or barangay health workers sapay sapay kumata surutin tayo dagiti protocols and health standards, takakaasid met nga attend kada tayo. Thank you, Dr. Trina. Thank you to the Gabriela Silang General Hospital, the Ilocos Sur Provincial Health Office, and also to your team who are here. These are young professionals. Na kayo amin na po, gyaman kami na imbag, nga rabi itay amin. Stay safe, stay protected, stay healthy. Good night. I love you all.